Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
According to the U.S. Department of Health and Human Services, someone is added to a transplant waiting list every 10 minutes. Now, April is Donate Life Month, and it's a time dedicated to encouraging people to become organ, eye, or tissue donors. And, it's a chance to celebrate with those who have donated or who have received a transplant.
With campuses in Arizona, Florida, and Minnesota, Mayo Clinic is the largest integrated transplant provider in the United States. And here to discuss everything transplant in 18 minutes.
And he knows it all.
Is the director of the Transplant Center at Mayo Clinic, Dr. Charles Rosen. Welcome back to the program, and congratulations. I think this is the first time that you've been here since you've been named the director.
Thank you very much. It's a pleasure to be here again and to promote organ donation and organ donation awareness.
Well, it is good to have you here. And other than the bad cough you have, you look pretty good.
Thank you.
For having just come back from a 10-day trip in Asia.
Thank you.
So it is Donate Life Month. And I see you have a little pin there. Did you bring one for me and Tracy? It says Donate Life. It's a beautiful pin.
I didn't do that, but I even upscaled it to the larger pin today. I actually wear the smaller one on every jacket every day I come to work.
You could get us one, though.
I can. In fact, we just ordered a whole bunch for the entire Transplant Center staff that'll be distributed next week at our staff meeting.
How beneficial is Donate Life Month?
Anytime we can use an opportunity to call to attention to the need for organ donation and what it means not only for our patients, but even for the donor families that are in a terrible situation and know that the death of their loved one can result in a benefit to others. We like that opportunity to do that, and every April when Donate Life Month comes around, we do everything we can to promote organ donation awareness.
You've been part of this for more than one April. Do you really notice a difference in people's interest in organ donation?
I don't know that we notice a difference that we can quantitate by seeing any uptick in organ donation, but hopefully more people will think about it, reflect upon it, and consider, if they haven't done so already, indicating on their driver's license that they'd like to be a donor in the event of their death, or putting their name on one of the registries to allow that to happen.
We're going to talk a little bit more about organ donation in the second segment. So let's talk now about Mayo's transplant program. It's huge, isn't it?
It really is. Last year, I think we did over 2,000 transplants across Mayo Clinic. That includes over 1,300 solid organ transplant procedures and about 750 bone marrow transplants. We're fortunate to be able to have 3 sites in pretty strategic locations across the United States, and our protocols are completely one and the same across the 3 sites. So we really look at ourselves as one Mayo Clinic with 3 doors.
What are the most common solid organs that you do? I assume, is it still the kidney?
The kidney would be the most common solid organ transplant, both because of the need and the fact that with deceased donors, there's 2 kidneys for every donor, and with living donors, it's a fairly straightforward procedure to donate a kidney with fairly minimal risk of complications.
All right, and list the other ones for us, if you would. So the kidney, number 1, what number 2, 3, and 4? And then tell us about some uncommon organs that you transplant.
Sure. Number 2 would be the liver transplantation, and most of those are deceased donor transplants, but we can do living donor liver transplantation as well.
Are you doing more of those more often now?
We are. And last year we did just over 20 living donor transplants at Mayo Clinic Rochester. And the reason for that is we could talk a little bit about organ allocation and how that's changed. But in order to receive a deceased donor liver now, you have to get quite sick. And so living donor liver transplantation enables somebody to undergo transplantation much sooner than would otherwise be possible, and also avoiding having to progress through their illness or even to the extent where they're critically ill.
All right, liver was number 2.
The liver was number 2.
3.
Heart would be number 3. And lung and pancreas would be 4 and 5. Small bowels would be a distant 6. And some of the other transplants that have been done include the face transplant, which we talked about last year, which is an incredible success. There's also extremity transplants for people that have had amputations. Laryngeal transplantation is being contemplated. And
laryngeal?
For the
Throat?
larynx.
Larynx?
Yes.
Okay, your voice box.
That's it.
Okay.
And also, there's been several uterus transplants done in Europe and in the United States for women that do not have a uterus, and that's their sole reason for infertility.
They were born without one, or they had it removed for some reason?
Either, most of them were born without one, but it could be removed for some reason. And then the uterus is transplanted, and it allows them to carry a pregnancy or two, and then we can take it out afterwards.
You're also doing multiple organ transplants. Tell us about that, and what's the most number of organs you've ever done at once?
The most common multiple organ transplant usually involves the kidney. So someone undergoing heart transplantation or liver transplantation, as a result of their heart or liver disease, their kidneys may fail as well, and then they require a combined transplant procedure. And it's very helpful when we do that with the same donor. The most that I've ever done or been involved with was a 3-organ transplant, which was a heart, a liver, and a kidney.
Is someone who's had, this is total layperson question, someone who's had 3-organ donation like that or received 3 organs, do they have a lot worse time with rejection, or do you have the same amount of rejection issues if you've got 1 organ or 3?
You have to triple the dose of the...
Yeah.
That's a really exciting question. And the reason it's exciting, when it involves the liver, for some reason, protects the other organs from rejection. Really? So liver transplantation, we use the same immunosuppressive medications, and they're very effective, but they're even more effective with liver transplantation. It's very rare for us to lose a liver to rejection. The patients may get an episode of rejection that requires treatment, but to actually lose the liver is very rare, so long as the patient's not naughty and continues to take their medications.
Why? Why does the liver do that, but lungs don't?
The liver can regenerate, and it just seems as though the cells or the bile duct cells are just not as susceptible to injury. And if they are injured, they can regrow. With a kidney, there's a specific structure to the kidney involving specified cells that really can't regenerate.
Okay.
And with the heart, once the muscle's gone, it's hard to grow back. But with the liver, it regrows. And so the liver will protect a heart from rejection and a kidney from rejection.
The liver doesn't care if it has a new host, but the kidney and the heart, they do.
Yeah.
Yeah. So we don't like it here.
You suggested that we talk about organ allocation. Why?
Well, unfortunately, we just don't have enough organs for everybody that needs them. And it's the biggest challenge in transplantation. It's quite daunting to me as a clinician, and the fact that when I see a patient in our transplant clinic in need of liver transplantation, on average across the United States, roughly 20% of the people that we would see in place on the waiting list for a liver transplant will die before a liver becomes available for them.
Is that most often with the liver? I mean, I guess...
Heart and lung transplantation are pretty much the same. With kidney transplantation, we do have dialysis, but dialysis is not as good as a kidney transplant, and there are longer-term complications resulting from that as well.
You could be on a heart and lung machine, no walk in the park. Is there a substitute for the liver while you're waiting?
There really isn't. We do have some artificial support devices that either involve liver cells or involve kind of a juiced up dialysis, if I can call it that way. But all of those are just limited to several hours or several days worth of support.
All right. Before we take a break, how about a quick research update? What's the most promising in the field of research with regard to transplantation?
Well, we're still pursuing xenotransplantation, which is trying to use animal organs for humans. There's
the pig. Are you still working on the pig?
We're
you haven't
not
given up on the pig, have you?
Yeah,
Didn't we have a lot of pigs here for a while that you were hopeful?
That was with the heart program mainly, but it all that would apply to other organs as well. There's cell transplantation, which is being examined, and also using cells, either human cells or animal cells, for liver support devices, and genetically engineered tissues that we hopefully at some day could use for transplantation.
So a lot of stuff out there
There is.
just hasn't come to fruition yet.
That's right.
But hopefully it will. And that will hopefully obviate the need for people to donate organs.
That would be wonderful. If I could be put out of my job, it would be fantastic.
All right, Dr. Charles Rosen, director of the Transplant Center at the Mayo Clinic. Time for a short break. When we come back, though, we got a myth or matter of fact.
That's right. Myth or matter of fact, one organ donor can potentially save 8 lives. We'll find out.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are back to continue to talk about organ donation awareness with Dr. Charles Rosen, who is director of the Transplant Center at Mayo Clinic.
Myth or matter of fact, Dr. Rosen, one organ donor can potentially save 8 lives. Is that a myth or a fact?
That's a fact, Tracy.
I thought it was more than that, actually.
Well, those are just the solid organ transplants that are available, but then there's corneas and tissues that are potentially available as well.
So which of the organs are life-saving? What 8 are we talking about?
Well, they're all life-saving. When we think of life, we want to do everything we can to help somebody live as long as they possibly can. And equally important, we want to help somebody live the best quality of life that they can. So I always look at our goals as trying to add life to their years and years to their lives.
Sure.
I can only come up with 4.
Well, I know. That's why I asked. Me too.
There's the heart and 2 lungs, so that's
2
3.
lungs. All right.
A pancreas, 2 kidneys, and the liver, which occasionally could even be split into 2, and then there's small intestine, and that would be the solid organ transplants.
So how many people are out there on the waiting list right now? Do you know? You have an idea?
Unfortunately, 114,836 as of 20 minutes ago.
No kidding. 114,000.
And Dr. Shives said a person is added every 10 minutes. Is that right?
Yeah. A
Dr.
person's
Shives
added
is
about
telling the
every
truth.
he's absolutely right. And unfortunately, about 20 people die every day that are on the waiting list without getting a transplant.
You had mentioned before we got started about a comment you sent over about when former fellows push us to change. What did you mean by that? See, we read the emails that you send us. What did you mean?
Well, as you know, Tracy, we have 3 transplant sites for Mayo Clinic at Mayo Clinic Rochester, Mayo Clinic Arizona, and Mayo Clinic Florida. And for each transplant organ or team, we have convergence groups so that we have the same protocols at each site. And so that transplant care at Mayo Clinic is the same at Mayo Clinic Arizona as it is in Florida and it is in Rochester. In Florida in particular, for me, it's a fairly personal because when we get together and we have to come to a consensus on what to do and we're discussing it with our colleagues, in Florida, I trained all but 2 of the surgeons, or they trained with me in liver transplantation in Rochester. And so sometimes you kind of wonder whether or not they should be disagreeing with me or wanting to do things a little bit different. But actually, when they do bring a different perspective to it, just as our own trainees do here in Rochester, and it's usually a pretty enjoyable conversation, and I think it all results in moving everything forward.
If you get put on a waiting list, if you need a new heart, does it make a difference where you live in the country? Or, we've got our 3 sites here, but all over the country. Does it make a difference?
It doesn't make a difference where the patient lives, but it does make a difference where the patient's transplant center is. Because the organ allocation is patient-driven. The organs are allocated to a patient at a given transplant center, but that transplant center's location does affect organ availability. There are a lot of things going on trying to do away with the geographic disparities across the United States in almost all the organs. As a result of that, there's wider spread sharing. But then those patients that are critically ill have a much higher chance of getting a transplant, which is very good for them. But it also means because we're limited to the number of organs available, that more of our patients that undergo transplantation are critically ill when they have the transplant done.
And it doesn't make any difference how thick your wallet is, right? We're here to dispel myths.
Absolutely not. The system is entirely blinded to anything that you could attribute to social worth for a given patient, and we specifically avoid that in all of our patient evaluation and selection processes.
So tell us what you're doing this month, Donate Life Month, to try and increase the number of donors.
In Minnesota, we work closely with LifeSource, which is the organ procurement organization that serves Minnesota, North and South Dakota. We have a number of events scheduled, both for donor recognition and public awareness with festivities. We have a donor walk, which is being rained out today, but we'll hold indoors at St. Mary's Hospital. And there's various stories that have been pushed or brought into the media to increase the public awareness of the need for organ donation.
What about marrow? Bone marrow donation seems to be mysterious for people like to sign up to be a organ or a bone marrow donor.
Yes. With bone marrow transplantation, many of the transplants are done with relatives when someone becomes ill, but sometimes that's not possible because nobody's a good match. And so there's a national registry which has people tissue typing done, the type of proteins that are on their blood cells. And so when someone needs a bone marrow transplant from an unrelated donor, they can look on the registry to see if somebody might be out there that's a good match.
Because that's different because it's a living donation. So
that's right.
Right. And so you don't, just write on, say in your driver's license that you're a donor. You go and go to an event to get matched or to get a blood draw and get typed. Is that how that works?
That's right. And or they'll take a swab from the mouth where they can look at the cells and get the tissue typing from that.
Not even a blood draw.
Not even a blood draw.
Wow.
Yep, and you get reimbursed for it, don't you? Isn't there some, if you're a donor?
He's all worried about the pocketbook.
Well,
over
there
here.
are because
I want you to do it, but I want you to know that we're very grateful monetarily.
Yes,
Right.
One of my close family members was actually was on the registry and called in to be a donor and had to travel to the transplant center in order to be worked up from a medical standpoint and also do the formal tissue typing with the blood draw. And so a donor is reimbursed for those costs related to that donation.
All right, a little bigger Christmas gift for me this year, Tracy. If you get it. So let me ask you why getting organs is still so difficult. Especially, it seems to me like cremation has been such a common practice now, as opposed to having a funeral, et cetera. Why wouldn't someone say, well, you might as well, I'm going to be cremated anyway, you might as well take my organs before I'm cremated?
When someone dies and becomes an organ donor, the procurement operation where the organs are taken out from the body can be done in such a way that you can have an open casket funeral without any disfigurement whatsoever. Even when the face transplant is done or an extremity transplant is done, that body part is replaced with a prosthesis that really matches things quite well. But with solid organ transplantation, the hearts, lungs, liver, kidney, pancreas, and so forth, there's no outward sign of that being done other than an incision on the abdomen and chest, which you would normally not see even at an open casket funeral.
So we all ought to be doing this. Tell us the simplest way to do it. Become a donor.
The simplest way is to indicate it on your driver's license, and when you have your driver's license renewed. And in the meantime, there's registries in every state that one can register on to designate your intent in the event of your death.
And you can restrict what organs they can take, right? If you say, I don't want them to take my eyes, you can say that.
It's difficult to do that with a driver's license, but it can be done, I think, on the registry.
All right. The director of the Transplant Center at Mayo Clinic, Dr. Charles Rosen, Everything Transplant. Good to have you with us.
Thank you very much.